And we are live. We're in Miami, and we're still talking about the theme we've been on all week, which is therapy. I'm with Dr. Joe. We're over here in Advanced Medical and Rehab in Miami. This is where Tony comes. This is where everybody comes to get their therapy. Clearly, I've been in Miami. I'm sunburned, but I want to take a minute to thank the sponsors. I want to thank Onnit Nutrition. I want to thank Crossbreed Holsters. I want to thank Kenzies Optics, Riton Optics, Taurus USA, and of course, Dr. Joe for having us. I had Dr. Joe work on me a little bit. He's been working on Tony for a while, and I wanted to get in here and do a podcast with you to discuss therapy a little bit. So, Doctor, tell everybody a little bit about, I did this with Bo Hightower. We were on the other day talking about hammers and chisels and therapy. You're a little bit different therapy, and I know you guys probably butt heads or probably see things differently. Give everybody a little insight into the importance of therapy and seeking therapy for athletes now. Most of my audience is going to be mostly athletes, mostly guys competing in some competitive sport. How important is therapy, and how important is it for folks to seek out therapy and seek out guys like you and the practice to get more information and to learn?
It is extremely important, especially at that high level when you're looking for longevity. Because nowadays, people are very familiar with all different types of diets. You have keto diets, you have the Mediterranean diet. They're very familiar with different types of fitness competition, how your body looks. You can make adjustments just based on the way you look in the mirror. When you have physical type problems and you develop shoulder pain or knee pain, it's not as easy to just say, I'm going to lay off the weights for a week, I'm going to go get an injection into my shoulder. You actually have to know what it is. And one of the reasons why people are misdiagnosed and they have these lagging injuries is because they don't get the right diagnosis. I mean, I think the very basic thing that you want to do is get an examination, get a physical x-ray to find out what your alignment looks like.
So yeah, I mean, I was in here the other day and I was actually really surprised. It wasn't just a churn 'em and burn 'em type situation. I didn't walk in and the docs weren't like, hey, jump on the table, let's snap you up and let's send you on your way and we'll send your insurance a huge bill. It was more of, you spent some time kind of sitting with me, assessing me, honestly more time than I was even used to, and also getting the x-rays, getting the feedback, and you kind of walked me through step by step what was going on with my body. So to you and to the whole staff here, and I know some of them coming in and out at Advanced Medical, I was kind of really taken aback by how much time you took to really do a proper assessment. And when you work with good guys in the field of therapy and in the field of PT in different areas, how important is it to seek out, and a lot of the listeners can't necessarily come down to Miami and can't necessarily come down to a facility like this. What advice do you give them when they're seeking out therapy and they're seeking out somebody like you to get some help?
One of the things that I would say is to find an office that has comprehensive care, where you have more than one type of provider per se per office. So for example, in an office like ours, we have physical therapists, we have medical doctors, we have the chiropractors, and also to be able to find a place where they do some diagnostics on site. So for example, some of the most common injuries that we're seeing with our professional athletes, with our high-level athletes, our fitness athletes, it's obviously the shoulders, the knees, and the lower back.
Right.
And it's not as easy as just saying you strained a rotator cuff. If you have bad mechanics of the neck, if you have poor mechanics of the shoulder blade, then you're going to have secondary rotator cuff problems, secondary bicep tendonitis problems, secondary tendonitis that affects the elbow. And the first thing that people want to treat is the area of pain. And I would say in 20 years of clinical practice, just zeroing in on the site of pain fails more than it succeeds.
And I know we'll have Tony come in, in a little bit, and therapy's been a huge part of his program, and everybody sees him going crazy on the internet. For me, over the years, I kind of felt like I hit a wall at about 33, 34, 35 years old, and we spent a lot of time talking about this. How important is therapy in adding years to your training? So for the folks out there that look at like the Tom Brady's of the world and the different athletes out there in any sport that are able to last into their 30s and 40s, how important is it to seek out therapy, whether it's PT, massage therapy, chiropractic therapy? How important is it for them to incorporate that into their skill?
It is the most important thing that you can do. Second would be diet and nutrition. But as far as having a base in terms of being able to compete, you have to have a foundation that is solid. You have to build a foundation of structure that affects posture and alignment before you can even address the muscular system.
Where would you put therapy on the list of, and I asked Dr. Hightower the same thing, on the list, on the spectrum of training, nutrition, so on and so forth. Where does it fit in your top 5, top 3, top 8?
It's definitely top 3. So you have to have number 1, desire. Then you have to have the work ethic kind of goes with desire.
You got to have the training, right? You got to have the training.
You can't do that. You have to have the desire to eat correctly, which is the make and break them. But then you got to have the foundation. You're dealt a hand with genetics. Sometimes just bad luck, where you're going to have injuries from a young age. One of the things, John, that we discussed the other day was really depending on where the injury is going to dictate how well it could heal by itself, if it can. Now, we're dealing with injuries of athletes, everyday people, that are beyond the ability to heal by itself.
Yeah, and I try to explain this to everybody, Doc, that on the spectrum of things, and this isn't discussed enough, how, where do you put the weekend warrior that's maybe in a softball league or maybe in this or in that? And of course, there's the Tonys that are training at a very high level, whether it's for sponsorships or for money or whatever's on the line. What do you say to the weekend warrior that comes in here and he's like, hey, I'm banged up, I play in a softball league, or my knee hurts, or I have degenerative this, or I have a hip injury. How many days a week should they be seeking out some level of active therapy, or how many times a month, or what regimen would you advise them? Because a lot of my listeners, a lot of my followers would be people that maybe hit the range once a month, or maybe they're at the gym 3 times a week, that's what they can do, or maybe they do jiu-jitsu, they're practitioners a couple times a month. How important is it for them to seek out some level of active therapy per month, and how much per month would you recommend just off the bat should they be getting in for, whether it's massage therapy or chiropractic therapy?
On a regular basis, meaning more than once a month. I would even say on a weekly basis. Let me just say this. People that are getting treated once a month, it's maintenance. So you're maintaining a level of wellness, but you're also maintaining a level of injury. Injuries are not going to progress with treatment one time a month, maybe twice a month. It's the same thing with fitness. You have to break poor biomechanics in the body with good input, sensory input on a weekly basis in order to see those types of changes.
So we got a question come in. What country? We're in the United States, so if you have any questions, we're actually in Miami. But, therapy is a really interesting topic for me, and I think it's the most under-discussed topic in sports right now. I feel like not enough folks are addressing it, not enough folks are talking about it. The only time you hear about it in the news is after the fact. Well, Tom Brady works with this trainer, or so-and-so works with that trainer. And you hear about it kind of after the fact. It's an afterthought. Oh, what's led to their career is this. Do you feel that that's a tremendously, I don't understand how to put it, maybe like an undernourished or underwatered, not discussed enough topic? And when you go to seminars, and I'm sure you do, you get out there and you're educating yourself, do you feel like it should be more at the forefront, and the doctors have more of a responsibility to get it out there and
Absolutely.
do stuff like this?
I mean, the nutrition, the workout of the day, it's all out there. But in terms of the nutrition, the physical therapy and the work in terms of maintaining the body, it's hardly discussed.
Rarely
discussed. But everyone has it. Every single professional athlete, every amateur athlete, every bodybuilder that's going to any degree of competition, every major sports organization has structural specialists like chiropractors and physical therapists on their staff.
Who are the worst guys to work on? MMA guys, jiu-jitsu guys. I hear powerlifters a lot. That comes up the most.
Well, powerlifters, the MMA, the bodybuilders, because they don't want to take the time off. There's really no off season for some of these fitness guys. Like a guy like Tony, per se. He's making videos and putting his body through a high level of physical stress on a weekly basis. So there's no downtime. So we've actually been able to develop a craft where we've been able to help these people who can't take the time off really optimize their healing and keep doing what they like to do.
Do you believe in overtraining?
Absolutely.
A lot of guys, that's a huge topic right now, as everybody says there's no such thing as overtraining. Tony and I butt heads and disagree on it. He'll say, oh, there's no overtraining if you take care of this, that. And I say, it doesn't matter to me, Doc. And I get into all the gruesome topics, and we kind of laid the landing, gave a little bit of an overview in the beginning. I don't care what gear you're running. I don't care how much shit you're doing or what you're putting in your body. To me, everybody hits a wall. I don't care if you're 42, I don't care if you're 44, I don't care if you're 45, you're gonna hit a wall at some point. And when you hit that wall, whether that's muscle tears, whether that's blowouts, whether that's atrophy, you're going to hit a wall. That's just a part of life. Now, we haven't found that wall yet, and Tom Brady hasn't hit it, but at some point there will be that wall. I don't like to speculate when that wall will be for him, because he's proved so many people wrong so many times, but I'm glad you kind of agree with me in that sense. But do you feel that we're pressing up against that wall and pushing it beyond its limits because of the level of the therapies and the things that you're doing here.
You know, Mother Nature's always going to win. But, you know, we've been able to cheat it somewhat with some of the newer, more advanced tools that we're using for physical rehab nowadays. But, you know, you're not going to see 60-year-old football players. That's just the bottom line. What's really the responsibility of the individual and the clinician is to come up with workable goals. How long do you want to participate in the sport? How long do you want to maintain yourself at a higher level? And the thing is, it's not going to get easier. You have to do more things the older that you get to get your body to perform the same way that it did when you were younger. That means more rest at times too. So the recovery, that's why football doesn't go 52 weeks a year. It's a 16-week season with playoffs. The majority of the year they're not participating in that type of physical stress. It's really meant on rebuilding.
So in that theme of rebuilding and maintaining and continuing to push the wall of what retirement is for athletes, what's some of the stuff you're doing here to help and to get people kind of through that wall? Now, not necessarily for the pro athletes. I know it's easy to go down that wormhole and stay at a high level. Talk to me about the guy who we met a guy the other day in Austin. You know, one of your guys, Gene, I think it was.
Yes.
And he's like 60 freaking years old, and he's shred. I mean, he looked great. And you're like, you know, we got him on this, we got him on that, and we're helping him. And the guy was full of energy. You know, he was one of those guys who walked right in and he was like, "Yeah, it's good to meet you." You know, like, "Yeah, like, you know, I'm pumping up," and he looked phenomenal. Talk to me about like the average guy, because not everybody's going to be a Tony, and not everybody, you know. How do you push that wall?
I would say there's two things in our practice. There's the physical side, repair the structure. Obviously, make sure the alignment is good. Get the X-rays. Make sure your spine is balanced, your shoulders are balanced, your hips and knees are balanced. But then, what do you do with the things that have worn out already? So there's two things. You have to replace what Mother Nature doesn't allow you to. I think most people become injured when they're 30 and 40 years old. So in our office, everybody does the blood work that has these issues of poor fatigue, recovery, low drive. They can't maintain their workouts because of nagging injuries. We do the blood work, and more often than not, they're deficient in testosterone. They're not making enough growth hormone. The inflammatory markers are high. They're low and depleted in vitamins and nutrients, and we get them on a program of testosterone and peptides to balance out their growth hormone.
You brought up a topic, inflammatories. So inflammatories are a huge, huge topic right now. Everybody's talking about how to beat inflammation. We see people do these cold tubs. We see people do cryotherapy is another one. We see everybody doing all these different types of treatments. What do you feel is the best way to combat inflammation? I mean, Tom Brady says, "I don't eat, tomatoes because of inflammation." What advice do you give to people to combat inflammation in the short run? Is it a cold shower?
Well, I'd say, how about we keep it in the field of orthopedics, nagging injuries, people that, injuries that stop people from doing what they like to do. The thing is that inflammation isn't always bad. Inflammation after an injury is what stimulates the healing process. So, for example, when you bang up your knee or you bang up your shoulder, you have an intense amount of inflammation. And that's where these healing cells in the body migrate towards, and particularly your stem cells. And stem cells are healing cells that stimulate your body to repair itself. If you think about pharmaceutical anti-inflammatories, Advils, Motrins, these ibuprofen drugs, they artificially reduce the inflammation, and your body never heals, and you're left with a nagging type of an injury. So in terms of systemic inflammation, in terms of orthopedics, you want your body to reduce the inflammation. You want your own cells to reduce the inflammation. That equals healing.
That's a great point. So how'd you start on this? How'd you even get into this? How'd you get so passionate about this?
Well, I'm 48 years old, and just like many of our listeners who were former athletes, played football, wrestled, and had the same type of shoulder and knee injuries that a lot of people did. When I got into my early 40s, hit the wall in terms of energy, drive, and I went to the guy in town over here in Miami that was supposed to be the bioidentical guy, and got on a program and just felt worse than when I started. And so I took it upon myself to join a medical organization, and it took me years to do it, but I got my diplomat in anti-aging, and we were able to put this program together that enabled me to feel amazing. I mean, I feel as good now as I did when I was 25 years old.
That's amazing.
Yeah. And then in terms of regenerative medicine, I have a mom that had some really bad knee injuries, kind of ran the gamut from medications to knee replacement, opted not to do the replacement, and we got involved with stem cells. And we've taken that to the highest of levels in terms of how to get someone better in a very short period of time, non-surgically, without drugs, and really an alternative to replacements.
And Daryl on here is asking a question about knee surgeries, and this is a common question, and I asked Dr. Bo Hightower this. Not everybody can go out and afford Dr. Joe. Not everyone can go afford Dr. Hightower. And Tony and I have been blessed because we've traveled the country and we've worked with some of the best, and we have an opportunity to get them on these platforms. What advice do you give to folks that don't have the resources necessarily available to them and don't have the means? Is it, Dr. Hightower made a great, comment. He said, it doesn't really cost much to come in and really get an assessment. Do you recommend starting with coming in and getting an assessment, getting looked at, and then figuring out what protocols you can afford and not afford? And what do you recommend that they take home with them? Do you give them homework? I mean, what?
Well, I'm going to agree with that statement. The worst thing that you could do is ignore it and kind of push through the pain. Getting a diagnosis to find out if it's something that'll heal by itself or it will get better on its own is absolutely critical to longevity. But more often than not, these treatments aren't very expensive. When we talk about some of the things like ozone or prolozone to stimulate the body to heal, when you're not talking about actually buying drugs, those are expensive. Things that really involve getting your body to heal by itself, it's a nominal cost, and it lasts a lifetime. So in terms of expense, both short-term and long-term, really I can't think of anything more affordable than working on or fixing your alignment.
And I know you're going to get into the ozone stuff, and we're going to touch on that. What are some of the therapies that are kind of, start me at the bottom of what you do and work me up the menu a little bit as to where you sometimes take guys? Not necessarily every candidate's good for this stuff, but take me through the beginning.
Every single patient that comes into the office gets a physical evaluation. For example, if we're looking at a shoulder or a knee, we're checking every single muscle of the rotator cuff, the pecs, the lats, all the way down the line, including the elbow, the wrist, and the neck and the scapula. You're taking x-rays. 75% of the time, you're going to be able to help somebody by just fixing the alignment. So everyone gets the base examination and the x-ray, and we're good 75% of the time. So, we're talking about Hall of Fame numbers, 75% success rate helping people. Then you got the 25% that don't respond as well to those types of things because, not that they don't work, but their conditions are more advanced. There's actually degeneration, meaning more cells in an area are dying than are being replaced. Then you got to talk about, well, how can you get the body to heal even when there's a deficit?
Right. It's a lot to think about. So where do people make the biggest mistake in therapy treatment? Is it they come once and they don't stick with it? You feel it's just the quitting, the falling off, and not having a regimented schedule?
Even that is that they stop as soon as the pain goes away.
Oh.
So the pain is the very last thing that shows up oftentimes. It's the first thing that goes away. But in terms of an x-ray or physical limitation, I guarantee you no one's x-rays are changing the day they have pain versus 2 days before they had.
So is going to a medical doctor probably the worst thing they could do?
It depends on what the condition is. Everybody needs to have a checkup. Everyone should get blood work. In an office like ours, you can do it all in one place. But there's definitely a place for medicine. When we're talking about physical rehab and structural injuries, orthopedic type of injuries, you definitely want to make sure that surgery is the last option.
Because I've always felt in my athletic endeavors, playing sports through the years, school, I feel the huge mistake people make is they get an injury and they go to the emergency room or they go to a doctor. Like when I had my pec tear, I trusted no one. Because I said, I go to the doctor and the doctor says, you're fat, your BMI is terrible, or this or that, and they don't really know. They know how to work on the bottom of the pyramid. They don't know how to work on the mid to upper level of the pyramid. And I by no means think I'm this high level athlete, but they're just not used to working with athletes at a certain level. Like, for example, having an injury, their first reaction is to do X, Y, or Z medically related. And it's not necessarily therapy related. Do you agree or disagree, or where do you kind of find yourself?
Having had a pec injury, a tear myself 3 months ago, I definitely found myself on the medical side because I had to have the surgery. But in terms of the follow-up and the recovery and the progress, everything that led me to where I am right now, being able to train again, is outside of what medicine did for me.
It's so critical today to have that out-of-the-box thinking as an athlete and as someone who's performing at a certain level, to seek advice from guys who have a certain area of expertise. And I was talking about this with Dr. Bo and talking about it with you, and I know we'll be talking about it more. It's a theme that's coming up a lot with Tony and with some of the athletes that we've all kind of circled with and are friends with. that just not everybody's used to working on guys like us.
Yep.
And you have to find people that have that skill set and are able to look at things a little bit differently. Look, okay, you did this, and this is the result of that, and this is just a change in your routine. And we're guys who are going to go through that wall, and then we're going to go through the next wall, and we're going to go through the next wall, and we're not going to stop doing it. And there's no days off, and even when there's days off, they're not really days off. So you're going to keep going. So guys like you become, in places like this, become almost like havens, for guys like us. So we have to really rely on places that we can rehab our bodies, take care of our bodies, and advanced medical here in Miami. It's really important to have a place like that and to have resources like you.
Yeah, and I completely agree. It's whether we're doing blood work and balancing someone's hormones, we're pushing optimal. One of the things that you mentioned about putting yourself on the medical side versus the optimal side, if you just look at a simple number like testosterone, the range of testosterone is enormous, ranging from, say, 300 to 1,200. Where are you supposed to be? And those charts, those graphs are just markers. They tested a bunch of 70-year-old men that looked like 70-year-old men, that recovered like 70-year-old men, and that's how they got the lower end of the scale. And then they looked at 20, 25-year-olds who had the highest levels of testosterone, and that became the high end of the scale. The thing is when you're tested as a 50-year-old or 40-year-old and you come in on the low end of the scale, you're called normal.
Yeah.
It's the farthest thing you can
crazy.
be from normal. You need to be, pushing optimal, making sure obviously everything else is safe, but all of our athletes are people that are part of a program. We're looking at those optimal levels versus just quote unquote normal.
Isn't it crazy how far it's come? 5 years ago, and even 4 years ago, the last 3 years, I feel like we've seen this drastic growth spectrum and change. It's almost like when we were younger, you'd see like a smoking ad on TV. It was no big deal.
Yes.
Now you see an ad every 5 minutes for men with low T, everything else. And I know we're going to get into all the other stuff. And do you feel like the controversy's kind of been taken out of a lot of that stuff?
Yeah, this is so much more mainstream. There's people asking for this now. It's 10, 20 years ago, yoga was a word that, my God, who does yoga? Now, yoga, everyone does yoga. The athletes do yoga.
How dare you?
Yeah. And with hormones now, not only have we found that it is effective, it keeps people performing at a high level, they feel better, they have more drive, but it's actually safer. We found out balancing someone's hormones for the remainder of their life leads them to die of all-cause mortality by significantly fewer numbers than people who don't. You got to think about this. The top 10 leading causes of death in the United States, number 1 and 2 are cancer and heart disease. 90+% of the people out there never even touch a hormone. And so that's without hormones. When you're taking healthy hormones and balancing yourself out, I don't mean just going to the gym and loading up with XYZ, but in addition to or getting that blood work done, you are going to be so much more healthier and have so much better ability to recover than anything else.
And no one ever advocates, Doc, going, and I've said this 100 times on my podcast talking to athletes, that the subject comes up of performance enhancement or anything like that. I tell people all the time, unless you're getting proper blood work and getting proper consultation, just going to the gym and loading up on even supplements, anything that you buy in GNC, because now everything's laced and everything's cooked, and you see supplement companies falling like flies because everything's cooked. And by cooked, I mean doctored, and they're getting hit by the FDA. I would argue you have plenty of resources available to you now to come into places like this, to spend time, to be able to get the expert advice, to be able to say, listen, you legitimately have a deficiency in X, Y, or Z, like you're saying. We can help fix that by doing this, this, and this, and here's the path. And without that guidance, it no longer has to be a black bag thing where you're in the back of a gym and you're like, hey, what do you got over there? You can get the actual real treatment and real help. And do you feel like, like you said, you have guys coming in here asking for it now. Do you feel like that tide has almost completely turned to where, seeing Gene yesterday is just so openly,
yes,
I'm taking this and it feels great. Like that taboo has been kind of run out of it.
It's been a huge crutch for us in the practice because, as I mentioned before, what we do in terms of structural alignment works 75% of the time. But, if that doesn't work, something is stopping your body from healing. Whether it's a deficiency in cells or it's a deficiency in hormones, just having the ability to offer that to our patients and actually show them in black and white, this is what's happening, this is why the inflammation may be persisting, even though the structure is corrected, or this is why the discomfort is persisting or the drive is missing, is because these hormones are low.
Right. So tell everybody about the practice here.
Yes.
And tell everybody, I'd like to get into this as we get halfway through, how they can find more information on you, where they can find more information on you, and what the best resource is to contact you.
We're right in the middle of Miami-Dade. You can follow us on Facebook or Instagram at APMR Miami. We are in Kendall, Florida, so we're just south of South Beach. Our number is 305-598-8788, and the practice is Advanced Physical Medicine and Rehab.
And the website?
The website is apmrmiami.com.
apmrmiami.com, and I'll put that link below so you guys can click on it. Is email the best path to kind of maybe ask a generic question? Hey, I'm interested in coming down. I'm interested in seeing you guys.
Yeah, my email that people can ask me questions directly is drjoeg@apmrmiami.com.
So as you somebody walks in the door brand new to a facility, and they come in on the blind, and a lot of my listeners that may not be in Miami or necessarily in the area, what's the first question they should ask a practice?
Do you have diagnostics? Do you have diagnostics? Am I going to be seeing a doctor today?
You're going to be seeing a doctor today?
Yes.
That's a good one.
Yes, because
really good
oftentimes you can see, I don't just mean a mid-level. I mean, mid-levels are amazing. You're going to be seeing a specialist. So whether it's a physician assistant, like we have our amazing.
You got a whole team here. I went through it the other day. I mean, I went in there.
So
you got radiologists. You got the whole deal here. I mean, this place is lights out. And I'll take a story of it later and put it up. But you have what? You got to have 20 employees in here?
We have 30 some odd employees.
30 some odd employees. And you're now going to be launching a podcast. You're going to be having all that. You got a radio show coming up. You have all these different platforms that you're going to be streaming from and putting the information out there. I feel that's huge. One of the things in my consulting company and branding I've suggested to a lot of brands is you have to put the information out there. We're in a consumer age right now, and it's exciting and it's scary at the same time because the availability of information is right at your fingertips, and I think it's what Google's the #1 search bar in the United States, and number 2 is YouTube. So you have so much information at your fingertips as a brand, as a company, as someone putting information out there. You look at the guys that are really getting a lot of content out there, getting a lot of stuff out there. They're using platforms like podcasting, radio shows, everything else. What are some of the things you're going to be talking about on the radio show and on the podcast?
We're going to be talking about regenerative medicine, persistent injuries that won't heal by themselves, the use of stem cells. Where do you get the stem cells? What are the best stem cells to use for what type of injury that you have? We're going to be talking about bioidentical hormone replacement therapy, medical weight loss, how to interpret blood work, physical injuries like golfer's elbow and runner's knee, all the things that keep the weekend warriors to the elite level athletes from really hitting the goals that they want.
Does the podcast have a name yet? Can I ask? Do we have a name?
The Healthy Dose.
The Healthy Dose.
Dr. Joe.
So if you're trying to score some stem cells, tune into the Healthy Dose with Dr. Joe. Now, stem cell research, I'm glad you brought it up. It's come up a lot in certain circles. It's an expensive one right now, but we've seen that price kind of slowly coming down,
yes.
right? And it's becoming more affordable and
Correct.
more active. What are some of the different? I've heard of stem cells being in IVs now. I've heard of them being you can get them in localized injection. What are some of the stem cell treatments that you feel are the best? And
well, in terms of orthopedic type injuries like necks, lower backs, shoulders, hips, and knees, and as far as also being compliant with what we can do here in the U.S., the intra-articular joint injections are what's compliant, more so than the IV. In fact, the IVs aren't compliant for those things. They're amazing procedures, but for orthopedics, it's definitely the intra-articular injection. One of the reasons that you mentioned that the procedure price is coming down is because they're not surgical anymore. 5 years ago, all the stem cells that we did in our office involved fat, adipose. And now we're able to use donor grafts from umbilical cord tissue that are non-surgical and don't involve the use of any type of drugs, and people are in and out of here within a day, hardly taking any time off from what they like to do, and their bodies are starting to heal again.
it really is amazing how far it's come in terms of athletics, even in my time. I mean, I can remember going back to high school, and I was a late 90s guy. It was take an ice bath and get back in the game. It's just come so far because of guys like you innovating and changing the game. And I know Bo the other day and some other guys I've interviewed, and I've had this conversation with with so many people, with Tony obviously at length, and of course, Dana and Rob Bailey, who are my neighbors in Montana. We talked about it. There's so many different treatments out there. Do you feel like a pioneer?
I do, especially being a chiropractor in this field. Whenever you're a chiropractor going into a medical field, you have to really know your P's and Q's.
Yeah.
As much or more so than the average person. And, actually going through it, being of the age where I've used all these procedures on myself.
It's powerful.
It's powerful. When you could use it on yourself and you can see the way it's helped you, your family members, it makes you even more passionate to get the message out.
It's powerful. Whenever you've done something yourself or you've tried it, I always say be a customer first. Mm-hmm. And that's why I love coming in, and Bo worked on me a little the other day, and having the ability to have you guys work on me a couple times. It's powerful to say, I've had the treatment. And coming here and talking to the listeners and talking to everybody, being able to say, I've spent the time and this stuff works. I mean, I feel like $1 million. Now, I had the luxury of having the ozone shot the other day.
Yes.
And 2 days in now,
yep.
I believe. And I've been having like a little bit of everybody knows, I had a pec tear on my left side. I have a lot of different atrophy and bullshit going on my left side. And I felt like $1 million, the last couple days, just moving around, moving in, especially today since it's really kicked in. And I just feel very limited pain. Talk to me about some of the more solutions like the ozone shot and how that can help.
So ozone and what we use here, prolozone, which is taking ozone to the pro level, which is combining it with different types of B vitamins and sodium bicarb and all these different great things that the body utilizes to heal. Really what it does is it makes your body and puts the affected joint in the optimal environment that the cells inside your body need to work. If you think about persistent type injuries, it's all location, location, location. The reason why surface injuries heal so much quicker is because right underneath the surface of the skin is blood. And one of the main functions of blood is to transport oxygen to the injury site. When you have stem cells circulating in your body and they combine with oxygen, they release these molecules that your body utilizes to heal itself. When you think about a knee, a shoulder, or a pec, much deeper into the body, much less oxygen available for healing. So even if you're pushing enough stem cells to that area, without the oxygen, those stem cells can't release what they need to that your body needs to heal. So you're operating at a deficit. It's one of two things. It's going to be one of two things. Either your stem cells aren't strong enough, they're not releasing enough of what your body needs, or you don't have enough of them. And the diagnostics and the muscle testing, all of that is going to be determined when you get the examination. And it's very easy. You can't miss on it.
What do you say to skeptics?
It's like gravity. If you don't believe in gravity, you don't want to step out a window because it always works. The way that your body is built, it's the greatest drugstore that will ever be known to man. All the chemicals, all the vitamins, all the nutrients, all the enzymes already exist in the right combination inside your body. And rather than try to recreate the wheel, we just want to spin it a little bit faster. Get rid of the interference, let the body start to heal itself, get the body back on track, and that's your best doctor.
That's great advice. That's the best way to put it. I mean, you couldn't have said it any better. I asked this of everybody, both the skeptics, but, in our line of work, everybody, I always say this, whether it's fitness or shooting or tactical world, everybody's somebody just ask them. Yep. So that's always the line I use. Everybody knows everything, so just ask them. You have to balance that educational component, and you have to be willing to give people, like you said, the diagnosis and give them an understanding and give them a full diagnostic report as to what's going on with their body and how they're feeling. And that's so important, but the person has to be willing to listen and understand and absorb the information. And if they're open and willing to absorb the information, that's going to be the most critical. Absolutely. I spent a lot of time in Montana last couple of years running a company, and I didn't have the opportunity to have access to all the great things that the city of Miami offers, and to have the types of treatments like this available. Now coming down here, one of the first things I said to Tony was I'd love to meet with guys like you and put guys like you on the podcast and have the opportunity to discuss all these different innovations, because they're what keeps people in the game.
Yeah.
They keep guys like Gene in the game, and they keep you fighting, and they keep you vital, and they keep you excited. And whether it's to go work out 3 times a week or 4 times a week or 1 time a week, they keep you at a high energy level and they keep you performing at an
Absolutely.
optimal level that you touched on.
Yes.
And I feel like so many people just neglect their body and neglect the treatments, and that's what leads to, I got a pain here and I can't do the softball league, or I can't do jiu-jitsu because of this, or I can't do this because of that. And they let it go and they let it go and they let it go. Do you feel like there's a time when it's gone too far and you can't bring someone back? Do you feel that it gets there?
In terms of orthopedics, there's times you wait too late. And what I tell every single patient, if we can help you, we will, but if we can't, we'll let you know that too and get you to the person who probably can. But when you look at an x-ray, you do a physical exam, if it's bone on bone, and I can't tell you how many times people say that they're bone on bone, you take an x-ray, it appears close to bone on bone, but you run them through an exam and they have complete normal range of motion. So you can't just treat the x-ray, you got to treat the patient. That being said, if a joint is blown up and you can't move a leg, you've waited too long.
Right.
And that's why you don't want to wait too long. It's a tricky system that you're dealing with. The skeletal system, the joint system of the body, is one that you can't see.
Now, I always pick on Tony at times, and I pick on myself. Is Tony too far gone? Can we not save him?
Tony's right where he's supposed to be. He's doing everything he's supposed to be doing. Tony's like a high-end car that needs a lot of tune-ups, but when it gets out to the track, it performs. And a lot of that, like we said in the beginning, is because of his drive, his determination. But he's got everything else balanced. What you don't see is what's behind the camera is the alignments, the work on the muscles, the stimulants,
and the commitment to therapy. Really,
yeah. Tony's as committed or more committed to it. What he does on camera, imagine that behind the camera. He has a full-time job taking care of his body.
Oh yeah, absolutely. And I can attest to that around him.
And I'll say this: if it works for Tony, imagine what it could do for everybody else.
Oh, absolutely.
Because 99.999% of the people aren't doing what Tony's doing.
Now you have a fantastic staff here that ranges in so many different disciplines, and they're so good at everything that they do. What are some of the key staff members you have that you've brought on, and what are some of the ones you're looking forward to bringing on maybe in the future?
We have an amazing team. Everyone from our front desk all the way to our massage therapists. But we have the reason that our practice works so well is because we have really smart patients, and we have really smart patients because our office managers, our physician assistants, our chiropractors, our physical therapists, they educate the patients along the way. We do some pretty amazing work with lasers and shockwave therapy for people that have really bad joints. The prolozone, the ozone therapy, the tissue grafts that contain the stem cells. We're bringing on IV nutritional therapy. I mean, the list goes on and on. As it comes out, I'm one of those guys with a really low ego and a big desire to help my patients. So if it's out there, I'm going to try it, and if it works well, we're bringing it in.
You'll have some new therapy coming in that might help with the ego a little bit too. Do you want to talk about that at all?
Yeah, well, one of the things that we've gotten into is, in the same way that we need to improve our hormone levels, is sexual wellness. And there's certain parts of the body over time that don't function the way that they used to when we were in our prime, and there's ways to get them back to functioning at a really high level without drugs and without surgery. It involves taking some of your own blood, spinning it, taking the richest, strongest components of it, and essentially transplanting it back into another part of the body.
And how do you do the transplant?
It is done by our physician assistant over a series of treatments, 3 treatments over 3 months. We utilize some home therapy in terms of tissue expansion. How do you get the tissue to expand? Just like if a woman is going to get a breast implant and she's on the smaller side, she wears the expanders first. There's ways to stretch the tissue at home safely, and then when you expand the tissue, there's ways to strengthen the blood flow, the oxygen to these different types of body parts. And what I can tell you is the couples that have undergone this therapy are extremely pleased.
I'm sure.
Both the husband and the wife, or boyfriend, girlfriend.
I'm sure. So I appreciate more than anything you having me in here, letting me go through the gamut of treatments, and I know it's something I'll be talking about even separately, and I always do podcasts with the folks that run the show like yourself, and then I do one myself where I'll talk about my feelings on the treatments and everything and how helpful they were to me. So I can't thank you enough, Doc, and I can't thank the staff enough for having me and everyone taking the time to put me through it as if I was here for 10 years. I mean, it's been, the other day, I know I was in here one day and I was on the phone and I had 100 things going on, but then I got a chance to come in with Tony and you put me through the gamut. I can't thank you guys enough. Everybody's been super professional. I appreciate you letting me come in and set up here and getting some feedback. What do you want to leave the listeners with in terms of advice, or what you would tell them seeking treatment. I know we've gone over kind of what they should ask, what they should do. You know, what advice would you give them if they're sitting at home right now and they're like, you know what, doc's right, my knee.
I would tell you this. All of these amazing therapies only work if you do one thing, if you do them. If you just think about them and wait for the time to do it, the time is never going to come. You're not going to be less busy tomorrow than you are today. Do it. Do it. Do it. Do it. Do something to help your body. Don't work through the pain and wait for it to get better by itself, because it's not. The fastest way to surgery and giving up the things that you like to do is ignoring the warning signs that your body is putting out there. But all these great things are available here across the country, but they only work if you do them. So get up off your butt and do something.
I'm excited for the radio show. I'm excited for the podcast. You have a blog up on the website yet?
We do. It's on our website right now. They can see it on APMR Miami.
Are you guys feeding the blog? Are you feeding it?
We're getting better. We're getting better at feeding that.
So I'm looking forward to checking that out. I try to do a better job of my blogging, but I definitely look forward to reading some of your white paper and seeing some stuff. So, you know, I appreciate that a lot of it. You guys have Instagram, right?
Yes.
What's the IG? At
APMR Miami.
APMR Miami. So at APMR Miami. Make sure you check that out. Website we said earlier.
APMRmiami.com.
And I'm going to assume email will probably be the best avenue to shoot you guys an email. Calling here, it would be more for scheduling an appointment.
Yes.
So
they can reach me at Dr. Joe G at APMRmiami.com. And Rob, the office one?
Office at APMR Miami.
Or office at APMR Miami. So, you know, if you guys have any questions about treatment, you're in the Miami area or you're in Dade or you're anywhere, South Florida, I imagine it's not a bad commute. Get over here. You guys, hours are what, 9 to
7 Monday to Thursday.
9 to 7 Monday to Thursday. If you're in the general area, you're coming through. This is a phenomenal facility. I know we have some of it on camera right now, and you can see treadmills in the back, but he's got offices everywhere. God only knows what's going back there. There's all kinds of equipment that I don't know. But so to kind of wrap it all up, you know, we touched on a million things. Doc, it's been tremendous for you to have me in, and I can't thank you enough for treating me genuinely from the bottom of my heart. I am eternally grateful anytime I get to come to a town and I get treated like family, and somebody takes me in and they're willing to say, hey, let's put you through some stuff and let's see what you're working with. It means the world to me, and then I'm able to give the feedback to these folks and to these folks seeking treatment. And a lot of them out there can't necessarily afford a Dr. Joe or the treatments, but I'm glad that you broke that wall down and said, just get in and get the assessment. And that's what I tell a lot of guys. Not everybody has a giant budget. So my last thoughts to everybody is, yes, you can't necessarily go out and spend $5,000-$10,000 on treatment. Tony's probably at $100,000 worth of treatments. But go out and get at least an assessment, get a baseline. And there's also financing that's available. If you haven't touched on, talking to whoever it is you work with about some type of financing option, get in there and get the initial assessment. You don't know if you have a case unless you at least talk to the attorney.
That's exactly, oftentimes we don't even charge for the assessment because we don't know if we can help.
Yeah.
And so we take down that barrier. And like you said, we brought Beverly Hills to the rest of the country.
And do you offer like a discounted first treatment?
Yeah, we do. In fact, every time a patient comes in and calls us, they hear about us on the radio show, they see us online, we bring them in and we check them at no charge. And then we go from there. And as you mentioned before, is the ability to finance or spread payments is critical to getting something done. And every single service that we offer in this office is affordable because you can do that.
So you don't need to sit at home and
have
your cherry juice and ice bag.
All you need to do is come to the office. And if you qualify for care, the last objection in terms of finances isn't even there. Everyone can afford this.
Doc, it's been a pleasure. I appreciate it.
Glad to have you.
So there's no excuses. Make sure you check them out. Head over and see Dr. Joe. Go over to, if you're in the Miami area, by all means come in. But make sure you check out the staff here. This is a beautiful facility. I mean, if you get a chance, Advanced Medical and Rehab in Miami, check them out. I want to thank all the sponsors, Onnit Nutrition. I want to thank everybody here, the whole staff. Everybody's been phenomenal. Can't thank you guys enough. Dr. Joe again. And, of course, all the sponsors, all you guys, everybody who's tuning in on iTunes, Podbean, everywhere that podcasts are broadcast. Check it out. This will be up on iTunes in a couple of days. But thank you all in YouTube world for tuning in. I'm going to sign off. So thank you.
Thank you.
Appreciate it. And thank you, everybody.